Hello, my name is Karen Block-Russell, and I'm recording this message in Kailua Kona, Hawaii, which is where I live. Although I heathered from the Midwest in Columbus, Ohio, and then Los Angeles, and now for the last 11 years in Hawaii. And I am a gerontologist and a holistic health counselor, and I have a three-part message I really wanted to share to you today. Part of it is related to health, part of it is related to COVID-19 and safety, and part of it is related to our global humanity and survival. In any event, I have been working in decades with the elderly, including running a 225-bed dementia facility in Los Angeles, and I care very, very deeply for the elderly and for all people, for that matter. And if you're interested in my background and credentials, and education, and experience, you could go to healthylifeadvisors.org and take a look at the About Me section. But the bottom line is I care deeply for people, and it's heartbreaking to see the stress and what's going on in the world, especially when there's a lot of wonderful things that we can do about it right now. We don't have to wait for a vaccine. And that is the part that I want to plead to our politicians, our medical professionals, and the general public, and that is, what can you do to improve your diet so you don't have comorbid situations to begin with, so that you feel vulnerable to being sick. I'm in the quote vulnerable category. I'll be 68 in a few months, and I've had one cold in 45 years. I feel healthy. I don't worry personally at all for COVID, personally. But I do worry for the rest of the world because I see diabetes, heart disease, illness, so many people just not taking care of themselves. And if people would consider eating a whole food, plant-based, organic diet, free from sugars, processed sugars, and oils, and it would go a very, very long way into protecting yourself from getting sick in the first place and getting all these comorbid situations that people are dying from in the first place. So please consider that, and if our politicians would spend just a little bit of the trillions of dollars they're spending on educating people about what it takes to be healthy, we would not have a lot of the problems that we're currently having. Now, I also exercise, I do yoga and meditation, and I eat, I avoid toxic chemicals and things that I put on my skin that would go into my body and not be healthy for me. I drink plenty of water, and there are lots of things that I'm happy to help anyone with free of charge so that they can live their healthiest life. Now, we also have to take a look at what's going on in the environment and the way that we eat and consume food. Factory farming is contributing to these pandemics with millions of animals crowded together, the feces that is in billions of gallons of lakes that cannot be transported across state lines for safety reasons. It can't be buried into the ground. And so all of these viruses are multiplying, they're mutating. Eventually they're going to be coming out in future pandemics. So we have to take a look at this right now. And these are things that we can do, and it's at the end of our fork what we choose to do. And at least if you are going to eat animals, we have to look at how are we raising them. And so that, along with the environment, because air pollution, especially in cities like New York, and it's one of the reasons we see the huge influx of cases, of course, all the density of the population, but the air pollution is showing scientifically that it impacts the virus. And so we have to take a look at that. And those are things that we can do right now. We don't have to, as I said, wait for a vaccine. We can do these things to empower ourselves, to reduce our stress and immunity. And that also brings me to the next point that I wanted to talk about, which is safety. If you don't take care of yourself, you can't possibly take care of others or function in society. And that relates to masks. So if we do need masks and protective gear in the hospitals and frontline workers. It's critical, it's life-saving, and when you're a surgeon. But if you're a healthy individual out in society, it actually is harmful for you to wear a mask that impacts and restricts your breathing. The brilliant Dr. Russell Blaylock, MD, who's a board-certified neurosurgeon, explained this very, very eloquently, because when you reduce the oxygen flow, you are increasing the stress. It's also reducing your immunity. It's pushing around viruses or bacteria on your face, which gets in your nasal passages. It increases the stress, increases your viral load when you feel like you can't breathe. So I'm not saying not to wear a mask, but you have to be able to breathe. So I wanted to share also what people that most of you trust, Dr. Fauci, the Surgeon General, Dr. Birx, the World Health Organization. So let's see what they have to say. These are their words about wearing masks. Let's see if I can get it to go.
Right now in the United States, people should not be walking around with masks. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often, there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
Masks are really not necessary, and they may actually be unhelpful.
You don't get a false sense of security that that mask is protecting you exclusively from getting infected, because there are other ways that you can get infected.
WHO only recommends the use of masks in specific cases.
And if you're not sick, you shouldn't be wearing a medical mask, but if you are, then you should.
People who are sick wear a mask. We recommend that people who are around someone who's COVID positive wear a mask, but do not recommend that the general public wears masks as a protective mechanism.
If you do not have these symptoms, you do not have to wear masks, because there is no evidence that they protect people who are not sick.
So that's word from people that I think most people trust. Now, I spoke to a doctor colleague, friend of mine, and we discussed the importance of being able to breathe. So he suggested making a protective mask that would protect me and other people. And what I did was use this plastic transparency sheets, which I picked up at the office store, and the headband, which I picked up at Target, and the double stick mounting tape. And I have a mask, which I can wear, that protects me, protects other people if I were to sneeze or cough, or they were to sneeze or cough on me, which has never happened in my lifetime, but if it were, this would provide some protection from my eyes, nose, and mouth, which are all vulnerable areas. So if you want to wear a mask, and you're required to wear a mask by your state laws, then this would be a good way to go, and it's really easy to make. I do want to say that that kind of brings me to the next part of what I wanted to share, and that is what's happening with our society. I listened to an incredible lecture interview by a brilliant triple board certified medical doctor by the name of Zach Bush. His website is Zach Bush MD. I don't know him personally, but after listening to him, I felt so inspired to learn what we can do right now and how to avoid when people get these serious respiratory where they're turning blue and they're being starved for oxygen. What can be done right now? I don't want to get into that because you can listen to him talk yourself, But it's something that I wish we could share this message with the frontline medical professionals who are treating people, because if that were the case, I think a lot of people would not be dying. But be that as it may, we also have to take a look at what is happening in our global society, what's happening to people. We, of course, need to be concerned with the people who are sick and becoming ill, but we have to also look at what's happening to the rest of society. Millions of people have lost their jobs. They're suffering, they're losing their homes, they're going into poverty. There's homelessness, the rise of domestic violence, suicide, sexual abuse, because people are in these cramped quarters. They can't get away from the people who are the abusers that they're forced to live with, where normally if they were working or going to the gym or out and about, they could, have some balance and get away from that. One of the mainstream media reported that their suicide rate was in 1 month what it was for the entire year. So our children are not getting educated. The elderly are not getting touched and visited. There's no opportunity for socialization. People are losing their jobs. They can't even afford medical care, and the people who need medical care aren't getting it because they're too afraid to go to the hospitals, and they're not even allowing for elective surgeries. So we have to consider this, and that's one of the reasons I beg people to contact their state officials, beg them to safely reopen the states. Little by little it's starting to happen, but really not enough. And so we're, to that end, this Friday here in Hawaii, on the 29th of May, we're having a peaceful rally to reopen the state and provide a choice for freedom and truth. And this is not political in any way, shape, or form. It is so bipartisan. And so we have to consider what's happening to everyone in the world. And if you really care about people, we cannot just have compassion for the people who are sick. We have to have compassion for all of the people who are suffering from mental illness and suicide and loneliness and depression and all the like, and losing their jobs and livelihoods. I met a man the other day who was doing some work in my yard, and he explained that he fell off a ladder. He desperately needed to go to the doctor, but he'd lost his jobs at the resort. He'd lost his contract for a house that he was constructing because the people lost their jobs and they couldn't afford to pay him. So it's got this horrible ripple effect, and it's just a tragedy. So I'm willing to help anyone with their health for free. You can look me up on healthylifeadvisors.org. I really care. We have a lot that's within our power that we can do right now to not live in fear and to boost our immunity and live our best and healthiest and longest lives. So to that end, I thank you for your time to listen. And if you can share this message with others on social media and pass it along, I would greatly appreciate it. Thank you.